Good night, my name is Carly Murillo. Today I'm going to talk about the effect of estrogen receptor-beta on mandibular condylar growth. Definition: the mandibular condylar cartilage play a key role in craniofacial disorders such as mandibular growth abnormality and temporomandibular joint degeneration. The mandibular differs from other articular cartilage in that it undergoes endochondral ossification and undergoes profuse remodeling during growth in the face of mechanical loading signals. Estrogen is an important modulator in the metabolism of bone tissue. They have an effect. The first one is osteoblastic differentiation, decreasing cell proliferation. The estrogen increases inflammation and decreases bone resorption. Next, we have a video.
The estrogen receptor, molecular and cellular mechanisms. Like all steroid hormones, estradiol circulates throughout the body via the vascular system and freely diffuses through membranes of cells in the body. In most cases, estradiol molecules travel through the cellular cytoplasm and then migrate into the nucleus, where the steroid exerts its major effects on cellular functioning. Steroid hormones, including estradiol, exert their effects by interacting with a special class of proteins called steroid receptors, found in the cells of target tissues. These receptor proteins have very specific binding properties and therefore associate with steroids and other chemicals in very particular ways. Estradiol and other estrogenic substances bind to the protein called the estrogen receptor. Although estradiol binds and activates estrogen receptors in both the cellular membrane and the cytoplasm, most of its sustained effects on cellular functioning are the result of its interactions with estrogen receptors in the cell's nucleus. In the absence of estradiol, estrogen receptors are distributed throughout the cell nucleus. These receptor proteins are large, complex structures that include a pocket called the ligand binding domain, into which estradiol will eventually bind. In the absence of estradiol, receptors are associated with a large cluster of proteins called chaperones that serve to keep the receptor in the correct conformation to allow estradiol to approach and bind to the ligand binding domain. When estradiol enters the nucleus and begins to interact with the receptor, the chaperone complex dissociates from the receptor and estradiol binds to the exposed ligand binding domain. As a result of this interaction, receptor complexes form clusters within the nucleus in the region of the chromatin.
Okay, next, application in dentistry. Estrogen receptor-beta has a liberating effect on the osteoprogenitins, being this protects of inflammatory mechanism. So the women with a lack of circulating hormone have an increase in inflammatory cytokines. And hearing the formation of new bone, consequently formation resorption condylar, and decreased bone density. Next, you can see the video.
Office, we do zero surgery to treat TMJ. In our office, we know that 90% of headaches come from muscle fatigue. So a lot of the symptoms that people seek out treatment for their TMJ are related to pain. So what we know about the muscles is that if we can get them calm, then that means they're in a good balance. And if we can get a good balance with the teeth, how the teeth meet together, how the muscles meet together, then we can get you in a better position to where the TMJ is not painful or anything like that. That being said, there may be indications where other doctors may need to be involved. If you were in a car accident, or you had some kind of accident where your bone to bone, how they meet are causing issues, or physical therapy. So there are indications for other modalities in the treatment of this, but what we found is that 90% of the time, headaches are caused just simply by muscle fatigue without any accidents causing any TMJ problems. In our office, if you were to come in, this is how we would treat you. We would take photos. We're going to take a look how the teeth come together. If the teeth aren't coming together properly, we know that there's also going to be a muscle imbalance there. If there's a muscle imbalance, there's going to be fatigue, and that can also relate to headaches. So what we'll do as our first course of treatment is to test to see if we can get your bite in a comfortable position and get the muscles relaxed. We'll make what's called an orthotic that goes on your lower teeth without doing anything permanently to your teeth. We're going to be adjusting the bite. We're going to be running computerized scans to see how your bite is tracking and how the muscles are being relieved. And there's all these facets that we're going to be doing over a 6-week period of time to see if we can get you comfortable. If we can get you comfortable and you start feeling more comfortable, then we can find out permanent options for you. Permanent options may be moving your teeth with orthodontics into that position of your comfort, and other options may be doing porcelain crowns and veneers to get your teeth into that position where they have a home. And sometimes it's a combination of both of those, moving your teeth and rebuilding some of the teeth. A lot of times when we rebuild some of the teeth, a lot of the teeth are already worn so much that we don't have to do a lot of work to the teeth because we're adding and building up to the teeth. So in our office, that's kind of how we treat our TMJ patients, and surgery is not done in our office.
Okay, next, cons and pros. Cons. They usually occur after puberty, with a peak in humans between the ages of 20 and 60. As there is a low concentration of estrogen, its protective role in bone metabolism will be enhanced, increasing inflammation and resorption. And the last one is the prevalence is higher for women and reproductive age. Pros. The severity of symptoms is related to age of the patient. The probability that it affects men is low, and the prevalence is lower for postmenopausal women. Okay, in the conclusion, the mandibular condylar is considered an important site of regional adaptive growth, expression of several growth and transcription factors that modulate cell proliferation of chondrogenesis. However, estrogen inhibits the growth of articular cartilage. Next one, you can see the video.
The mandibular condyle is a rounded projection at the end of the lower jaw, or mandible. This particular part of the lower jaw articulates, or unites, with the skull. It is actually better known as the condyloid process, which refers to the condyle itself and another part of the lower jaw. The mandibular condyle greatly contributes to the ability to rotate the head. The lower jaw, from a side angle, resembles the shape of the letter L. At the top, positioned at the rear end, is the mandibular condyle. The area immediately below it is referred to as the neck of the condyloid process. It functions as the constricted support system of the mandibular condyle. It is this condyle that provides the attachment to the temporomandibular joint, or TMJ. This joint of the jaw is formed from two bones, the mandible itself, and the upper temporal bone. The latter is located at the base and sides of the skull, and supports the area between the eyes known as the temple. An articular disc, which is a thin and oval structure made up of fibrocartilage, helps to form the temporomandibular joint in its location between the mandible and the upper temporal bone. The mandibular condyle provides the surface necessary for the articular disc to accomplish this function. The mandibular condyle also assists in the attachment of the temporomandibular ligament. Also known as the external lateral ligament, it comprises two thin and short fasciculi. These fiber bundles that comprise the temporomandibular ligament are attached to the lower jaw via the neck of the condyloid process, more specifically, at the neck's lateral surface and rear border. The temporomandibular ligament helps prevent the lower jaw's rear displacement as well as the condyloid process from going upward, which could fracture the skull's base in the event of a blow or some other kind of force. At the opposite end of the mandibular condyle, separated by the U-shaped curve known as the mandibular notch, is the coronoid. It is also referred to as the coronoid process or coronoid process of the mandible. Thin and triangular, it derives its name from the Greek word koron, which means like a crown. This part of the mandible, however, is not as prominent as the mandibular condyle, which is thicker and larger. Supporting both the condyloid and coronoid processes is the ramus. This part has two surfaces and four borders, and plays a part in the innervation of the mandible and the lower teeth it supports.
Okay, it is for the presentation. Thank you for your attention.